Hi, my name is Sarah Lark. I am a nurse practitioner student, and tonight we'll be doing the cranial nerve assessment. I have my husband here, Justin, who will be my patient. So the first one we're going to look at is cranial nerve number 1, which is olfactory. So I'm going to ask him to close his eyes. I'm going to take something for him to identify and tell me what it is.
Snickers.
All right. So cranial nerve number 1 is intact. Next we'll be looking at cranial nerve number 2, which is optic. We checked his field of vision earlier, and his on the Snellen chart, his right eye is 20/20 and his left eye is 20/20. So optic nerve is intact. Then we'll look at cranial nerve number 3, which is ocular motor. Number 4, which is trochlear, and number 6, which is abducens. So what I'm going to do is take a pin light and have him follow it to check the 6 cardinal fields of vision. Then I'm going to use the pin light to check how his pupils react to light. I'm going to stand about 12 to 14 inches away. Go ahead and follow the end of this. Alright, next I'm going to check his pupils. Alright. Both pupils were equal round reactive to light accommodation. So cranial nerves 3, 4, and 6 are intact. And next we will look at cranial nerve number 5, which is the trigeminal. So I'm going to take the Snickers that he identified earlier and have him take a bite. Alright, and so I'll be looking at the masseter muscle as well as the temporal muscle to see as he is chewing, which are obvious that they are intact. So that's cranial nerve number 5. Next we'll look at cranial nerve number 7, which is the facial. So I'm going to ask the patient to close his eyes tightly. I'm going to ask him to smile. So go ahead and close your eyes and then smile. Alright, cranial nerve number 7 is intact. Next we'll look at cranial nerve number 8, which is the vestibular cochlear. I'm going to ask him to go ahead and occlude one of his ears. And I'm going to whisper something in one and see if he can hear me.
Hello?
Alright, cranial nerve number 8 is intact. Next we'll look at cranial nerve number 9 and 10, which is glossopharyngeal and the vagus. So what I'll have the patient do is I'm going to take my pin light from earlier. I'm going to ask him to open his mouth, and I'm going to look at his uvula as he says ah. Go ahead and open up. Say ah.
Ah.
Alright, cranial nerve number 9 is intact. And I'm going to ask him to say hello.
Hello?
Alright, cranial nerve number 10 is intact. There is no hoarseness. Next I'm going to look at cranial nerve number 11, which is accessory. So I'm going to ask the patient to move his head from side to side. Alright, cranial nerve number 11 is intact. And lastly is cranial nerve number 12, which is the hypoglossal. So I'm going to ask the patient to stick out his tongue. Go ahead and stick it out. And then close your mouth. Cranial nerve number 12 is intact. Hope you enjoy.